Hello and welcome to the 43rd Bi-Monthly Coalitions webinar. I am Kinkini Banerjee, the Coalitions Relations Manager at USBC, and I'm so glad to have you join us for this session. This webinar series is jointly hosted by USBC and CDC's Division of Nutrition and Physical Activity. The webinars are referred to as the 222 and are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. And the purpose of the series is to bring together breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. We alternate the sessions, so we bring you one webinar with a national focus followed by one that highlights a state's success. Any breastfeeding advocate or member of a coalition could participate in our webinars. If you're not already on our mailing list, you could go to our website, www.usbreastfeeding.org/signup. This national call will be followed by regional calls. So for those of you participating in the regional calls, you'll need to hang up from this call and dial your state's call-in telephone number. And your state's designated contributors manage the call-in lines for your coalition. I'll go over some logistical details. All the handouts from this webinar and some other relevant resources are posted on our webinar page on our website, and here's how you get to it. On our home page, you can go see a section on the right which says quick links. The fourth item underneath that is the bi-monthly coalitions webinar. So if you click on it, it'll take you to today's session materials as well as an archives from all our past sessions. All participants are in listen-only mode for today's session, and we'd love your questions. We set about 10 minutes for Q&A at the end, so you can type your questions at any time during the session, and I'll forward them to our panelists. So here's how you do it. On your screen, you should see a control panel on the right. In case you don't see it, it might be minimized, so you might want to look at the orange tab with the white arrow and click on it, and it'll make the control panel pop back out. Scroll down, and the questions section is just under the audio section. So if you click on that question panel, it'll open up a text box for you to type your questions in. If you have any audio problems or other tech problems during this session, please email office@breastfeeding.org and someone should be able to help you out. And that brings me to today's session, Coalitions as Vehicles of Change. As our previous Surgeon General, Regina Benjamin, said, everyone can help make breastfeeding easier. We need to continue the momentum of the Surgeon General's call to action and work together with moms, families, communities, healthcare providers, employers, researchers, and policymakers to make sure that women achieve their personal breastfeeding goals and more babies receive breast milk as their first food experience. Today, 3 state coalitions will share their experiences in establishing processes to make a positive impact on the landscape of breastfeeding support. Debrah Trankel is going to present the first segment called Birth of a Coalition. Deb is the president of the Hawaii State Breastfeeding Coalition, and this summer she helped American Samoa start a brand new coalition. In the time that I have known Deb, I've been struck by her determination to strengthen coalition capacity in the Pacific Islands and make sure that federal partners keep this region's interest on their radars. A self-described sponge for information, Deb soaked up the workshop sessions at the 2012 Coalitions Conference. She took the information back home and shared it widely with her coalition colleagues and began consistently applying many of the tools, especially the coalition building ones from Tom Wolfe. Deb has used her personal vacation time and her warm aloha spirit and taken them to Samoa, spending 2 weeks bringing together stakeholders, conducting multiple trainings to get a lactation support program, as well as a new coalition off the ground. Dr. Maria Gayapa and Josephine Lam Yuen, who led the effort from the Samoan side, are not able to join us today, but we will have them on a future webinar to hear how the Samoa coalition is doing. I am delighted to have Cerise Bouchard, the president of the Lactation Improvement Network of Kentucky, or LINC as it's called, share the coalition's current work in building capacity. This is such a beautiful picture of Cerise with her little ones, Garrett and Rami. Cerise is the kind of leader every coalition should have. Not only is she committed to empowering mothers, she's a dedicated advocate for policy and systems changes to improve breastfeeding support in Kentucky. Cerise is that rare leader who actually relishes change and truly welcomes new possibilities. Kentucky is participating in the Best Fed Beginnings project and received an extra capacity building grant. Cerise and her colleagues are using this grant money in a number of creative ways, exploring technology options for better reach and member engagement. LINC has also partnered with a coalition's coach, the extraordinary Tina Cardarelli, to support them in this process. Cerise will share with us today how members are working to bring together multi-sector voices to determine a common agenda for breastfeeding in Kentucky. Our final presenter is Marion Rice, the Executive Director of the Breastfeeding Coalition of Oregon, and this is Marion with her beautiful son, Griffin. For those of us lucky to know and work with Marion, we marvel at her boundless energy and her ability to constantly push the envelope to take her coalition into the next cutting-edge initiative. Taking on the helm of BCO after its founder and previous executive director, Amelia Pesmite, left to join the USBC team could not have been easy. However, Marion has not only taken on where Amelia left off, she has guided BCO through significant achievements in the past year. Marion's perspective and wisdom on coalition focus for social justice and racial equity are phenomenal. And Marion also serves as the coalition regional rep for the West Pacific region. Marion will share what she calls BCO's big rocks and a sampling of funding proposals in the works to address capacity building for collective impact across the 18 local breastfeeding coalitions in Oregon. And with that, I'm going to pass this on to our first presenter, Debrah Trankel. Take it away, Deb.
Thank you.
We see your screen.
Okay. Slideshow from beginning. Do you see it?
Yes.
Okay. And so, aloha everybody. I'm going to let you know how things happened in Samoa. We were told repeatedly by all the stakeholders and organizations. We kept hearing it in stated in different ways, but everybody kept saying, boy, you're just at the right time, in the right place. And so what happened is I met my partner, Josie Lamuan, who is a nurse and also the VP of Quality and Safety at LBJ Hospital in Pago Pago, in my Nursing Executive Leadership Master's Program. And she actually came to Hawaii physically. Most of the classes are online, but she did come to Hawaii. And I didn't know anything about Samoa, so we were talking about Samoa. And as president of Breastfeeding Hawaii, I, of course, wanted to know how breastfeeding in Samoa was going. And she said it's dismal at best. 20 years ago, Samoans were breastfeeding, but then in the meantime, they've gotten Kentucky Fried Chicken and Taco Bell and McDonald's and boatloads of formula. They do not have any lactation consultants anywhere. There's not one certified lactation consultant. And so rather than helping moms with breastfeeding, they just hand them formula. The WIC office in Pago Pago hands out $250,000 worth of formula a month. So I determined that something needed to be done, and I felt like with our leadership role that we could make a change in the Pacific. So we set out to do just that. We did a gap analysis and looked at one of the main things they wanted at LBJ was a breastfeeding room. They'd talked about it. Employees had asked for it. Right at the time that we started, the employees were using a closet or the hallway. There's no spaces there at the hospital for them to express. There's no such thing as a Medela breast pump over there. They had, at best, hand pumps or manual pumps. There were no breastfeeding policies in the hospital and nobody to support the breastfeeding moms. And so we set out to contact and enlist as our champions the administrators, physicians, and nurses at the hospital. So we had a communication strategy of how we were going to use it to get the breastfeeding program in the hospital. And then we decided at that point, we did a logic model, and I said that, you know, what's going to happen when they go home? It really has to be a community-wide lactation support program. So outside of the hospital, we had to really look at who are the stakeholders, what are the organizations, and then we needed to get a hold of all those people. So the other thing we did is set up a timeline. You know, we didn't want this to take forever. They need help right now. And so we set up about, this looks like about a year's timeline, but from the time we started talking to the time that we started doing something was really a very short time. We already, within a month of just having a casual conversation, we set things in motion. So you can see the timeline here. Once we did a gap analysis and decided all of the different, we had things going on at the same time. We were working on the breastfeeding space. We were working on who are the groups that need to be involved, the organizations, and what kind of information should we be giving them. So I developed all the teaching tools, the presentations, the classes, and Josie was my wingman as far as getting a hold of all these people and getting me in contact with them so that, for example, the labor and delivery nurses, I spoke with the labor and delivery manager and I said, how can I help you guys? How can I bring what's best for moms and babies now to your nurses and what way can I support them? What kind of information would be best for you guys? Can I put on my scrubs and get right in there with you and do some deliveries? I was welcomed with open arms, and that was another thing that contributed to the success is these guys wanted the information. Like me, they're sponges. They want all the information they can get a hold of, and they're very grateful for it. So if I taught them something on Monday, they were trying it already on Tuesday. That was really cool. So enough on the timeline. Then we set out to give out the basic information. You guys know all this information, you know, why it's best for moms and babies, why it's best for society and environment. That all still applies to Samoa as well. But they don't have that information. So we wanted to make sure that everybody was on the same page and sharing our vision for their community. One piece of work that I really like that I believe I got this also from the 2012 conference was this WIC Works, building a breastfeeding friendly community. If you guys have a look at that, I think one thing that helps coalitions is having a lot of partners. because then there's strength in numbers. You have extra people that can help you work on your projects or your events or your initiatives, and also it brings together more resources, whether it's human resources or financial resources, or, hey, you know, I have a meeting space you can use. You'd be surprised. Here in Hawaii, we've been working a lot with healthy mothers, healthy babies, and really having a really neat collaboration. Don't forget your business folks, especially when you're looking at protecting and supporting the moms who are going back to work. Community-wide, we did deliver a lot of information to churches as well, really asking that the church as a community support our breastfeeding moms. Samoa was beautiful. The people there are gentle and humble, and they don't have any homeless people in Samoa, so they're very willing to help each other in this community. That's what struck me, is there's no homeless people in Samoa. They're doing something right there. So anyway, after doing gap analysis, logic model, communication strategy, timeline, and identifying the stakeholders, it was time to get on the plane and go over there. And I went over there with videos and brochures and handouts and self-learning modules. The other thing that Josie and I identified is not everybody speaks English, so a lot of the information and learning materials needed to be translated. So what's wonderful is Samoa never had any information translated regarding breastfeeding, and now they do. They have multiple things translated, both for patients and staff, and anybody who will be needing or giving breastfeeding support. I got off the plane. This was my hotel. There's like 2 hotels there. It was pretty nice. And this is what I was greeted by, is a bunch of men that were running around with no shirts on. This is the Samoan NFL players, and they were there for a football camp. You might ask, what's the relevance with this talk? Later on, these guys were asked to be on billboard, flexing their muscles and saying, I made it to the NFL, over the top of the picture and underneath it, and I was breastfed. That turned out to be one of the strategies, and these guys were more than willing to be on the billboard. Here's the hospital, LBJ. It's just a flat hospital. This is also the site of the first coalition meeting that we held. We had a lunch and a dinner once we got all of these people, all of the groups and units and stakeholders all had either presentations and or classes on breastfeeding and how to support the moms. We got them all together by utilizing a luncheon format, and then later on also a nice dinner that Josie and I both paid for. There's only one highway around this island, and that's important because any information that's put up on breastfeeding, everybody has to see it coming and going. And these guys are big on billboards. Every stakeholder group that we visited got different information, the information that was pertinent. You might recognize some of the things on the table there if you look really close, but I took over, I believe, 18 cases of stuff from CDC, HRSA, various brochures from WIC, Department of Health, you name it. Anything I could get my hands on, I took over. Here's the educational materials that were provided, and what happened is I paid probably $1,000 for different videos like Latch 1, 2, 3 and Dr. Diane Spatz's Power of Pumping, and just all of that, the golden hour, you know, all the videos that you guys know are just wonderful videos, both for teaching staff and for teaching parents. I bought all that stuff, took it with me, and left it there for them to use. Their nursery did not have a chair with arms on it, so I went and bought them a chair. These kinds of things are the supports that they needed. We turned in a coalition needs survey. I sent that to Kinkini. When we had our dinner, we went ahead and filled out our coalition needs survey, and I sent that in. And also, I believe there was about 37 people between the lunch and the dinner. This group here is the ladies that were in the office that were support for helping me get to all my classes and all my presentations. This is the postpartum nurses, and I did lactation rounds every single day and helped moms who maybe hadn't even thought about breastfeeding to breastfeed and showed them how easy it was. The classes and presentations, the folks that we could count, it was 424 people, and then all of the radio shows, TV shows, billboard messages, didn't count all the people in the churches, all of that. So thousands and thousands of people were touched in the 2 weeks that Josie and I put our program in place. I am going to say that administrative support, whether it's at the organizational level, you know, your directors and those kind of people, or whether you're making changes in the hospital, to have the admin support is really, really important, and we had that. And you can see behind Dr. Lidua's head here, he's the Chief Medical Officer at LBJ. You can see the sign that says breastfeeding room, and then there's the universal sign for breastfeeding below that. In the churches, it's a little scary going into the churches and talking about breastfeeding because they're very formal people. And so I just reminded them that Jesus was breastfed, and we went from there. And I was welcomed with open arms. These are the chiefs, government officials of Samoa. So Samoan Affairs is behind us at this point. They told Josie anything she needed. When I got there, they were shaking my hand. When I left, I was getting hugs. And they really got on board when they understood how big of a difference in their diabetes rate and their heart disease rate, a simple thing like breastfeeding could help. These ladies are from Tafuna Health Center. So I did extensive teaching with the WIC counselors as well as the outpatient and health centers.
Deb, you have 1 minute.
We decided, okay, for the moms that delivered out in the field, they needed to have the skin-to-skin transport. Babies were actually getting to the emergency room hypothermic. When the police department found out we were doing these classes, they wanted classes too, so we ended up adding classes and more classes. This is a dads and grandparents class. I had to do 6 of those because they got bigger and bigger. Labor and delivery nurses. We did skin-to-skin in vag deliveries and C-sections, and to this minute they continue to do those skin-to-skin contacts. Sewing classes. Here's the grand opening of the breastfeeding room. There's the new breastfeeding room. They gave us an actual patient room. There's the admin, radio stations, TV shows. We did all kinds of broadcasts. The classes got bigger and bigger. It was all over the news. Project successes. The outreach was incredible, and they've had 2 breastfeeding meeting or coalition meetings since then. They had a big, huge week-long breastfeeding week celebration that was community-wide, and we continue to do data collection to see how we impacted the breastfeeding rate. Our recommendations are to continue the capacity building and the outreach, and we need to get somebody in there that can certify maybe 20 to 25 people to become certified lactation consultants. So no matter whether they go to the hospital, the clinic, or their WIC counselors, there's somebody there that can help with breastfeeding. Okay.
Thank you so much, Deb.
I will hand over. Okay. Sorry, that's a lot to give in 13 minutes.
And our next presenter is Cerise Bouchard from the Lactation Improvement Network of Kentucky.
Start with a little bit of a history of LINC relative to Coalition. In 2010, a breastfeeding summit was held in Bowling Green, Kentucky. The summit was organized by the Kentucky WIC program. The participants included public and private interested individuals, as well as some dietitians, as this was held as a pre-conference session to their professional association conference. This was largely a brainstorming session to identify the key areas needed to be addressed for improving breastfeeding rates in Kentucky. And each idea was voted upon, and that began the foundation for the development of a document called the Strategic Plan for Improving Breastfeeding Rates in Kentucky, which I will refer to as a strategic plan going forward. A follow-up summit was held in October. This was a much smaller group of interested individuals, and at this meeting, the coalition was named the Lactation Improvement Network of Kentucky with acronym LINC, and the state plan was refined. And then the following year, a third summit was held in Louisville. And at this summit, the strategic plan was released and distributed, and the coalition was launched. And officers were nominated. And then the officers were voted on electronically after that. So that was when I became president of the coalition. And the other officers and myself started formalizing the organization. So the first thing we did was we found an attorney who was gracious and volunteered her time to help us. We drafted articles of incorporation, got our tax ID number, drafted bylaws, and developed the other documents that would be needed for filing our application for tax-exempt status, and also did things like open the PO box when checking accounts, so all those little things to just get the organization formalized. So while we had a larger interested force of people through the WIC program working on the strategic plan, it was a much smaller group of 4 to 6 officers and the attorney working on developing and formalizing LINC. The amount of time that those projects took and a few other issues that we had caused our volunteer attorney to quit before we were ready to file our application for tax exempt status. So that was our first little bump in the road. In 2012, we had some officer changes, and then the board started meeting on a more regular basis. We were really excited to get to the work of the coalition, which is improving breastfeeding in Kentucky. We'd attended the USBC conference and heard from all the other coalitions around the state about the amazing and cool projects and initiatives they had accomplished. And so we were really ready to start getting to work and doing some fun things. But the board was still small, and all of us had full-time jobs and families. And every time we had an idea, we got caught up in the sphere of our limited resources and inability to mobilize the masses. So before we got started on taking on any projects, we decided to take a step back and figure out who we were as an organization and focus on a few things for 2012. So we decided to start by developing a vision and mission, a logo, launch a website, give Breastfeeding Champion Awards, and get some fundraising going. So we started with the vision and mission, and I don't think any of us had a clue that it would take so much time and effort to develop such a simple thing. And we started by looking at the mission statements of the existing breastfeeding coalitions. And at the time, nothing seemed quite right for us and what we wanted to do. The USBC conference was fresh in our minds, and the Surgeon General's call to action was relatively recent. We kept coming back to this statement from the Surgeon General, that everyone can help make breastfeeding easier. So we had a lot of things that we didn't want to do with our vision and mission. We didn't want to get caught up in the mommy wars. We felt like the breast is best argument had already been won, and a lot of the other more established coalitions had done a great job of getting that message out. We felt like most people knew the benefits, and that the issue that we were dealing with now is that moms just didn't have enough support, and that other people and entities in the community didn't know how to support moms and babies. We really focused on the word everyone, and we didn't want to focus or put the blame on just the mom and baby. And we knew that our rates were already telling us that moms and babies want to breastfeed and are failing at reaching their goal. So we know it's not the mom's fault. And I know I'm preaching to the choir here on this one. As we thought about what our coalition could do, we saw ourselves as a resource for families, businesses, physicians, governments, people and entities other than just the mom and baby. And we started throwing out words that we liked. Since we couldn't find a good statement, we just started with words. So we threw out resources, collaboration, inclusive, encourage, impact, build, link, connect, support system, community building, transform. So you can imagine the length of the first few versions of our mission and vision statements. There were so many words and so much that we wanted to do, but we also didn't want our mission and vision statements to tie us down to doing something or not doing something as the organization evolves. So we had 2 meetings of this, throwing out words and statements and saying yes and no, and we like this and we like that, and really analyzing every little single word. And after those 2 meetings, none of us felt really sure that we had gotten there, so we decided to think on it until the next meeting. And when we came back at the next meeting, we realized we had figured it out, took out a word or 2, and we ended up with the mission to make breastfeeding easier for all Kentuckians, and a vision of a Kentucky where a culture of support for breastfeeding is the norm. So in hindsight, it seems like such simple statements for the amount of time it took us. But it did turn out to be exactly what we wanted it to be. And this also became the foundation for our logo, which you've already seen. But again, we wanted to keep the focus off just the mom and baby because we felt like that could also just help perpetuate this idea that it's the mom and baby's fault, it's the mom and baby's problem, and it's not anybody else's. And we wanted the logo to resonate with everyone that we would approach, including business owners or community leaders that might not really like that image of a mom and baby breastfeeding as much as we like it. So in this past April, another breastfeeding summit was held. At this summit, we were given the opportunity to give an update on the work that the board was doing. And then after the summit, we held a meeting. During the summit, we unveiled the mission, vision, and logo, and it seemed to be well received. And we launched our website, which is breastfeedkentucky.com. We also presented our needs for officers and more board members and presented the accomplishments of the past year. And we also awarded our Kentucky Breastfeeding Champions, which was one of the goals that we'd set for the year. So we accomplished almost everything we wanted to do in the first year. So at the meeting, we presented this list of what a coalition could do and asked what the members that were present at the meeting wanted to do. The need for better communication was expressed. And of all the potential projects we presented, the most interest seemed to be in ensuring that physicians had evidence-based information on breastfeeding. So we feel like we have a couple of places to start. Oops. So I just skipped my slide. Where we are now is that we haven't tackled the goal of developing a sustainable fundraising plan. So we haven't reached that goal. And this leads us to having a fear of committing to any long-term or recurring expenses. And despite the interest in the meeting at the summit, we haven't really heard from a lot of people who are super interested in devoting their time to developing the coalition. Our current board members are suffering from some burnout of working hard on all these behind-the-scenes things for the past few years and feeling like we haven't had a chance to work on projects that truly impact breastfeeding. And of course, we've all had personal changes in our lives that are giving us less and less time to devote to the coalition. So right now we're focusing on the low-hanging fruit so we can keep our momentum going. We were awarded coalition capacity building funds from USBC. So we're going to continue with the annual breastfeeding awards as that's something that can be promoted publicly. And we've asked people to keep an eye out for individuals who are making a difference in breastfeeding. And we really tried to focus on individuals who do it outside of their profession. Of course, we still award people who do it professionally, but we're also trying to find those individuals who impact breastfeeding just in their daily lives or in their communities and don't even realize that they're doing it. So we're trying to find people like that. We also realized that our website didn't meet our needs, so we're working on refining that. And we're going to start communicating. So we just launched our first e-newsletter a few weeks ago, and we had a 30% open rate, which is a little bit higher than average, so we're excited about that. And let's see, as far as our challenges go, we still feel like mobilizing the masses is our biggest challenge. So Kinkini suggested that we use some of our capacity building funds to contract with Tina Cardarelli, and we have really loved our conversations with her and her ideas for getting things moving. She really had us kind of scale back and just focus more on making the coalition fun and reaching out to individuals instead of these big picture projects that we had, so that we could at least start communicating and mobilizing the people that were interested instead of trying to reach out to people who may not have an interest in improving breastfeeding. Indiana's right next door to us, so we're hoping to make it there to witness some of her meetings, and we're planning on making some of the changes to the website. Right now we have it set up free through WordPress.com, and we're going to switch it over to WordPress.org to allow us to have some plugins that will create a searchable resource list and allow people to subscribe to the email list and things like that. As far as the 501c3 status right now, we're still in limbo. Tina shared with us some of the difficulties that other coalitions have had, and we're not sure that we're in a position to sustain that. However, we have pretty much everything done for the application, pretty close to being able to submit it within the time frame that they give you. So we also don't want to lose the opportunity to apply for grants that status would allow us to do. So we're still weighing all our options on that one. So in conclusion, I just want to say that I think that link mirrors the state of breastfeeding really well. We know there's a need. We have great intentions and lots of enthusiasm. But without a lot of support, we floundered. And we were one of the lucky ones that powered through. And now with more support, we're getting going again, thanks to the help and support of USBC. So I will pass it on to Marion now.
Okay, thank you. Okay, let's see. Can you see my screen?
Yes, we do.
Yep.
Awesome. Well, thank you, Cerise and Deb. I'm totally inspired. So I am following in the footsteps of giants, as you all know. It's pretty daunting, but I've been in this position for a year now, and I am so personally and professionally fulfilled. It's beyond anything I expected, and I love working with all of you. So that said, thank you to USBC for allowing me to share a little bit of our optimism and some of our challenges and kind of where we're at. So this presentation is about the Breastfeeding Coalition of Oregon, and kind of we are rebuilding for collective impact. We're refocusing and focusing in, focusing out, and I look forward to talking with you about what's happening. So today we're going to discuss our new direction, and I hope we can do that by kind of focusing on our big issues, as Kinkini said, our big rocks. And so, as you know, things are changing dramatically with healthcare reform and the Affordable Care Act. And BCO, you know, obviously is the statewide entity that serves to build and link families and community partners and influence policy and do all of those things to support, promote, and protect breastfeeding. And with healthcare reform, Oregon has been a leader in looking at how to really use basically a collective impact strategy to address providing better and more affordable health care. And now all of Oregon's children are covered under our new health care reform. And early childhood in particular has been aligned. All of the child care network and all of the early care has been now aligned with our K-12 education system. So there's lots of systemic changes within the context of how healthcare is delivered in Oregon and how early childhood education is delivered, that it's creating an opportunity for the BCO to address new audiences. So with that, over the last 9 years, we've incubated with our Oregon Public Health Institute, which is a 501c3 nonprofit think tank to really push healthcare and public health in new directions. And we are kind of at a crossroads. The Public Health Institute has a new executive director, and BCO is in the process of clarifying how we work with them moving forward. It's not dissimilar to things that are happening in other states with our neighbors to the north, Washington in particular. BCO has had funding. We've had feast or famine, it seems. I had a conversation with Amelia Pismike last night, which was, yeah, right now BCO has zero funding. Our funding ended September 30th. We had $27,000 from WIC last year, and right now we have nothing. But some days it seems daunting, but other days it seems like an opportunity to make new friends and go in a new direction. So just like Cerise said, we need to become more sustainable. We need to build capacity for our collective work. Our coalition suffered from a little bit of burnout too. We kind of floundered around with this big governance structure. We had all these governance documents. We had an executive committee. We had some really dedicated people. They're pretty tired now. And, we don't necessarily need all that governance structure for the size of the organization we currently have, which is like a volunteer. So we need to right-size our governance documents. We needed to attract new board members. So we kind of took a page from USBC this past year, and we modeled our call for new board members, and we had 11 candidates put their hat in the ring. We held elections, and now we have 7 new board members, and we have allowed what was our executive board to move into an advisory capacity. And now they are so happy to be the wise board members, advisors now, I should say, wise advisors that we can call on to say, hey, what happened in the past? Or can we have your opinion about something? And so we just finished having a big summit. WIC gave us a little bit of extra money to bring as many coalitions as we could afford together. And so we installed our 7 new board members at that meeting, and we have our first new board meeting on October 15th. So we have actually 19 coalitions in Oregon now. Just last night I got a pretty inspirational email, and we have a new coalition forming. So I can show you, oops. Here are where our coalitions are. We have 16 regionally based coalitions, the red and purple dots, stars, and then we have actually now 3 emerging cultural coalitions. We have the Oregon Intertribal Breastfeeding Coalition and the African American Breastfeeding Coalition of Oregon. And just last night I got an email, and we started a conversation with 3 amazing Latino women who are bilingual, bicultural, and they are so excited to work with BCO to build the Oregon Latino Breastfeeding Coalition. And so we're moving forward with that too. So the context in which we work is, obviously very similar to what you are facing. Everybody has their own CDC, information about your breastfeeding rates and what's happening. And, people look at Oregon and say, wow, you have such great initiation. And we do. We absolutely do. But one of our biggest challenges is that that's not equitable. and what we're seeing is that while we have wonderful initiation, we don't have equity across cultural equity. We have economic disparities in our breastfeeding rates. And so we really feel like we need to build bridges across geographic locations with our coalitions and into culturally specific coalitions that can increase culturally competent care and breastfeeding support. So to do that, and at the urging of the USBC, we are moving towards filing for nonprofit status, and that's one of the first things that I think our board will probably discuss is how do we organize for sustainability towards that status. So we do have a number of proposals for funding pending that I've worked on, but you know, we don't have any knowledge that we're going to get funding. We just have a head of steam and a very strong will. You know, we just held a collective impact summit. We had 15 coalitions there from all over the state. So we had $10,000 from WIC, and we were able to bring Liz Weaver from the Tamarack Institute in Canada. She was the same person who presented at the 2012 conference that USBC had. We were so inspired by her, and we felt that we were ready to bring together regionally based and culturally specific coalitions to really look at their individual coalition work, but also to take the conversation twofold into the larger, well, how can BCO govern itself in a way that is beneficial to you? What are our short, medium, and long-term goals together, as well as in our regions and in our culturally specific coalitions, and how do we cross-pollinate? It was a very dynamic and awesome meeting, and it, you know, the sum of its parts was much bigger than I could have imagined. I think people were feeling like we finally had this, you know, these deeper relationships with each other, women who, predominantly women who were doing this work. They got to meet the new board members. The board members got to hear kind of what their challenges were and are, and what their hopes and dreams were for our statewide coalition as well as their local coalitions. And, you know, it was powerful. We don't all have, you know, enough resources. I'm struck by that every day, being in nonprofit work for almost 20 years myself. I'm struck at the potential impact of our work is so deep and so important that sometimes I scratch my head at how other federal projects get funded. But that said, at our meeting we came up with some key, we call them big rocks. You know, I think of Sisyphus moving the big rocks uphill, and we have these big rocks in common with other nonprofits at work here in the state, one of which is Family Forward Oregon. I don't know if you have similar organizations in your states, but pay equity for women with children. You know, women still don't earn as much as men, or women without children. That's a huge barrier. Paid family leave, huge barrier. Baby-friendly hospitals, hopefully the perinatal core measure set will, for exclusive breast milk feeding, will help us. Obviously helping the general public and professionals in maternal child health understand the cultural and environmental barriers to breastfeeding through a social justice framework. You know, many of them do, but we have so much work to do in that area. Convening and opening discussions to address the racial inequity barriers. We learned so much from our colleagues up at the Washington Racial Inequity and Breastfeeding Support Summit, and we would like to do a similar thing here in Oregon. Working with employers to understand and support workplace lactation as part of wellness at work strategies and an expression of their business ethos in a new economy is super important. We're going to go present at a workshop about creating flexible workplace on October 16th with our friends at Family Forward Oregon. We're talking about, another big rock is we're talking about media engagement, presentations, and group advocacy and public policy initiatives and social media, all of those things, and how we work with our local coalitions and our culturally specific coalitions to craft messages that are, you know, develop a common agenda. It's really important to us. So also working with child care providers and centers to understand specific needs in caring for breastfed babies and help parents to understand the specific behaviors that breastfed babies in care have to extend duration. We did those 2 videos with Indiana Perinatal Network, which we're continuing to develop a program that we can, you know, deliver statewide to help child care and parents understand. We're also just recently, last March, I wrote a letter on behalf of a public employee who was required to travel on business and who could not take a state car because they won't let her take a state vehicle if she's breastfeeding and needs a care provider. Well, we believe we now can make the case that it's a biological imperative to keep mothers and babies together if they're separated more than 8 hours due to their job, and we think we might have an opportunity in this state to actually change a law. And so we're moving that big rock up that hill one day at a time on this. And if you in your state have any policies around employee travel in state cars for women who are breastfeeding, please send them to me. So again, you know, we find in our state that there are some big discussions happening around healthy community planning and healthy food access. And just recently I wrote a proposal to go to a food justice summit, and it was about infant first food as part of a food justice agenda. And you know, I think there's a tremendous opportunity there to broaden the discussion about healthy food access, and for those folks, those public policy folks in, you know, farm to school and in healthy food and food deserts and looking at distribution of where grocery stores are, to think about the very basic needs of breastfeeding women and access to, you know, supporting breastfeeding as part of that discussion. And I think that is, that is it.
Great. Thank you so much, Deb, Cerise, and Marion, for these terrific presentations. I am inundated with questions and comments, but just as an overview, we've listened together to 3 coalitions at 3 different stages of evolution. The Samoa Coalition was formed around a big project, and now we hope that they can sustain the momentum and keep going. Link is experiencing what so many of our coalitions are going through right now, that we do have you know, people, it's flagging a little bit, needs people to get and rejuvenated again, and so they have done such pragmatic practical things to get back on track. And of course, with BCO, you do see that when you have a coalition that's been active for some time and has the resources, what you can do with that. So I have some questions here. For Deb, it's like, we didn't hear where the funding came from. Deb, do you want to tell us about the funding for this, what you did at Samoa? Deb? Are you on?
Okay, I had to unmute myself.
Okay.
Well, because we felt it was kind of something we really wanted to push forward and not wait around for an opportunity to find some kind of funding, basically I paid out of pocket. I paid for my plane ticket, I paid for my materials, I utilized all of the free stuff I could get a hold of as far as brochures, pamphlets, booklets. I really did a lot of research to see, you know, what does CDC have, what does HRSA have, what does the Department of Health. There's a lot of wonderful WIC things. I didn't have to pay for interpreter because Josie did all of the medical interpretation.
Yeah.
And so I paid for my plane ticket, I paid for the hotel, and if I needed something, I just bought it. So I didn't have to have anybody's permission. I just moved it.
Yeah.
And then I went on my vacation. So my full-time job at Queens Medical Center, although everybody here was very supportive, you know, I was able to utilize my vacation and just go ahead and go do it. Just do it.
Yeah, thanks, Deb, and that is really such an incredible labor of love, and it makes us understand that our brothers and sisters in the far-flung islands have so many barriers and challenges, and that they need so much support in their public health infrastructure. So I have a comment here which says, "Thank you, Debrah. I'm clapping out loud in my cubicle and crying. Absolutely amazing." Okay, our next question is for Cerise. And how did Link get participation in the BF in your breastfeeding summits, and how is Vic working with Link? You have a couple minutes.
Well, the breastfeeding summits are organized by WIC, and they take care of everything. Since Link grew out of the first couple summits and out of the WIC initiative, we've had that line of communication with them, and WIC is a part of our coalition, and all of the regional breastfeeding coordinators are part of our coalition. So pretty much we just ask if we can have a small session, and we usually have about a 15 or 20 minute. The past few years we've had a 15 or 20 minute session to just give an update on Link. And since the breastfeeding summit lasts until about, I think it's about 2:30 or 3, then, and the space is already paid for, we've asked to use the space after the summit to hold our meeting. And they have been more than willing to allow us to do that.
Okay, terrific. Thank you. And then BCO, we had a question saying, are you involved with church groups, faith groups, and SHRM? SHRM is I'll get this. The Society for Human Resource Management, the SHRM. So, Marion, just a question wanting to know if BCO is partnering with faith groups as well.
Well, not right now. We're not partnering with faith groups, but our coalitions are.
Okay.
And with regard to SHRM, one of our new board members is very active in SHRM, and so, you know, that's been a harder nut for us to crack. We haven't been able to get their attention, and I think part of the reason is this backlash against the, you know, people think, oh, we have this rest breaks for milk expression law here in Oregon, everything's fine and hunky-dory. Mm-hmm. But what that doesn't do is change workplace culture, and so it kind of masks the problem that women are still having a hard time. So nobody wants to talk to us about workplace stuff that much, but women are having a really hard time. So we're excited about our SHRM, our board member who's very active in SHRM and in human resources in general.
Fantastic. And we will, for questions that I haven't been able to get to, there are some questions about strategic planning and how do you make decisions. I will be looking at all of them and getting in touch with you personally to answer your questions. And we will move to our next section, which is announcements. And I just want to do a very quick announcement that our 2014 Coalitions Conference is coming up. The 5th National Conference of State, Territorial, Tribal Breastfeeding Coalitions is coming up in August 2014. So a major commitment of USBC and an emerging priority for all breastfeeding organizations is a focus on ensuring equity in breastfeeding support. So a lot of our conference program will be heavily informed by the needs assessment, coalition needs assessment, so we can build a program that really continues to build on the skills, and we will also be doing a lot of work on equity so that all coalition reps leave the conference with an understanding about the role coalitions can play in ensuring all families have access to quality breastfeeding support and services. So stay tuned for calls for presentation proposals coming out this winter. And I am going to transfer this to Megan, our Executive Director right now, to talk about the Subsidized Attendees and Advocacy Day. Megan?
Great. Thank you, Kinkenny. Can you hear me?
Yes.
Okay. Great. Well, don't leave yet. I have still two more important announcements, but I will try to be very quick so that we can end on time and get over to the regional calls. But Kinney has passed over to me to talk quickly about the money side. And as you know, we are doing our webinar today, CDC-less, unfortunately. With the government shutdown has certainly put a wrench in a lot of things at all levels, federal, state, and local. But I can report to you that we are working and are quite confident of a mechanism to continue to fund the 2 subsidized attendees for every state and territory coalition, just as we have done in the past. So do plan on and expect a similar situation for that. The 2 folks per state that have their flight, their airfare covered, as well as the 2 nights of shared hotel, and then those folks also receive a discounted registration fee. I am sorry to report, though, that we don't know anything yet about the state WIC breastfeeding coordinator situation. As many of you know, we have had funding for those folks to come to be subsidized attendees as well for some of the conferences in the past, but not all. And of course, the WIC situation with funding is a little bit precarious and difficult right now, so we will certainly report back to you as we learn more, or if that becomes an opportunity, but that is not something that I can say anything for certain about at this time. Kinney, if you want to flip to the next slide, I just want to say one other quick thing, which is about the 2014 Day of Action. So we're actually renaming the Advocacy Day. We're going to call it a Day of Action this time, and it will again be on Monday the 4th after the close of the conference. And I really want to encourage everyone. This is really a critical opportunity for coalitions and for individual folks to attend. We're already there in D.C., and it's just such a great opportunity. I know it's frustrating with Congress. I know the timing sometimes is off. But regardless of whether you see the actual congressperson or senator or a staffer, building those relationships is so critical, and this is such a valuable opportunity. So I really want to encourage all of you, and as your coalitions begin the conversations about who will attend in subsidized slots versus non-subsidized slots, that you really think and encourage everybody that's coming from your coalition to stay for this Day of Action, as many folks as you can. We do provide a boxed lunch, busing transportation. We take you right back to the airport by 5 o'clock. We'll have a training and a briefing, leave behind materials, everything to make it really easy for you to go that day to the Hill. And I also wanted to provide a couple of links here that you see at the bottom, because I know one of the things that we've heard concerns about over the years is folks being concerned about, oh, can I lobby? I'm a government employee, or can the coalition lobby? Is that okay? If we're a nonprofit or we're trying to get our 501c3 status, I know there's lots of concerns about that. There's a couple of really great resources here that are linked. I know you can't click on the link at this moment, but if you actually go to the USBC Breastfeeding Advocacy HQ link right underneath there, that's usbreastfeeding.org/advocacy, these are also posted there. And the one from the National WIC Association is especially useful for individuals, thinking about you and what you can do as an individual. And then I really love the name of this from the American Bar Association. Nonprofits and lobbying, yes, they can. So please check those out, and do encourage the folks from your state who are going to be coming to the conference to attend. We really need you there, and hope we can all bring our voices together and just continue to spread the word and build those relationships at educating our congresspeople. So that's it for me. More from us as we move forward with the conference planning. But thank you, everyone, ladies, for such a great presentation today from all 3 states. And to Kinney, I know we can't hear everyone, but I hope you'll all join me in a round of silent applause for such a great presentation today. Thanks, everyone.
Thank you. And for those on the regional calls, you can now get on to your regional calls. Thanks again, everybody, and look tuned to the next one in December.
Thanks, Kinney.
Thank you.